Pain relief for patients with kidney disease. You are watching a production of GoodHealthTube.com. Before we move on and talk about pain relief and kidney disease, we recommend you watch the entire video, as later we will mention a program that may allow you to reverse your kidney disease. This is quite controversial in the eyes of mainstream medicine, but let's get back to talking about pain relief for now. The dilemma facing kidney disease patients and pain control is the use of non-steroidal anti-inflammatory pain medication, otherwise known as NSAIDs. Although NSAIDs are often used for control of mild to moderate pain, they directly stress the kidneys. For a person with normal kidneys, taking a few days of NSAIDs will not harm normally functioning kidneys. But for those with chronic kidney disease, these pain medications would be rarely used if at all. Examples of NSAIDs are as follows: ibuprofen, Advil, or Motrin. They are different names of the same drug. Aleve and naproxen, naproxen. These are also the same drug. Aspirin is also an NSAID. Other examples of NSAIDs include meloxicam, Voltaren, Toradol, and indomethacin, also known as Indocin. In addition to being used for pain, aspirin is often used to thin out one's blood. This is thought to decrease the risk of stroke and heart attack. However, there is debate as to whether the potential benefits of taking aspirin are outweighed by the risk of worsening chronic kidney disease. Taking chronic aspirin can make one prone to stomach ulcers. Also, the clinical picture becomes more cloudy when chronic kidney disease itself is a risk factor for heart disease and stroke. So what are the options for a kidney disease patient? It depends on several factors such as the cause of the pain, other comorbidities, and various psychosocial factors such as age, family support, and access to healthcare. The options for pain relief in kidney disease patients include acetaminophen, neuropathic pain medication, and opioids, narcotics. Acetaminophen is the active ingredient in Tylenol. Acetaminophen is not an anti-inflammatory pain medication. Its pain-relieving effects come from acetaminophen's interaction with the brain. Since it is metabolized by the liver and not the kidneys, it is deemed safe in the setting of kidney disease. One should, however, not take more than the recommended dosage to avoid liver disease. Neuropathic pain medications includes gabapentin and pregabalin, Lyrica, among others. These medications are effective specifically for neuropathy-related pain. Since neuropathy is not uncommon in chronic kidney disease patients, these medications may be a good option, but their dosage will often need to be adjusted based on one's kidney function to avoid the accumulation of the drug metabolites in a person's system. You can learn more by watching our video entitled, Gabapentin and Stage 3 Kidney Disease. A link will be in the description. Narcotics, opioids, can be used in chronic kidney disease patients, but several of these pain medications are metabolized into substances that rely on the kidneys to be excreted from the body. Some of these narcotic medications such as tramadol, and its metabolites, are cleared with dialysis. It is generally safe to use tramadol, oxycodone, dilaudid, hydromorphone, fentanyl, methadone, and buprenorphine. Codeine is not recommended in renal failure patients. Methadone and fentanyl do not get dialyzed out of the body during a dialysis session, unlike others. Moreover, the metabolites of methadone and fentanyl are not active like the parent compound, so usually no dosage change is required. These opioid medications, except for codeine, can be used, but caution is advised, and these medications must be prescribed by a physician since the adverse effects can be quite serious and can include death. It is not uncommon for them to be prescribed at a low dose in kidney disease patients and then have the dose titrated up. But again, close follow-up is indicated. To summarize this video, NSAIDs should be avoided with the possible exception of low-dose aspirin. Acetaminophen, the active ingredient in Tylenol, is safe. Some neuropathic pain medications such as gabapentin are safe with modified dose adjustments, and narcotics, except for codeine, can be used but with much caution and close follow-up with a physician. If you have kidney disease and are interested in learning how to possibly reverse and care for your kidneys, click the link below in the video description. You will be taken to our blog post, which we feel is the best blog post for kidney disease on the internet. From there, you can take a look at the plan to potentially reverse kidney disease. This is not a scam. You can also check out our kidney disease playlist. A link will be in the video description below. We hope you enjoyed this video on pain relief for patients with kidney disease. Please like, subscribe, and comment. More valuable videos such as this are in the pipeline, which you can watch in our kidney disease playlist. Hit the notification bell to be notified when more videos become available. This video is not a substitute for consulting a physician. It is not intended as medical advice. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.